Hey guys, Dr. Damon Stewart here with NSI Stem Cell. Today I want to go over a few simple stretches and exercises to begin to deal with your knee pain. So starting out, we're going to be stretching a muscle called the popliteus. It's a muscle in the back of the knee, and it is known as the unlocker of the knee. So with this exercise or stretch, we're first going to be using a block. So if you don't have a block, you can just stack either a couple books or a step stool. But we're going to be placing the foot on the block or the books with the back leg straight, and back actually a little bit further. We're then going to be rotating slightly out, and we're going to be flexing down at the waist and extending the back to begin to stretch the popliteus in the back of the leg. And you should feel a stretch down into your hamstrings and a tightness in the back of your knee. So that muscle over time gets very tight and it can produce a lot of knee pain. So again, we want to be starting out. The back leg is straight, placing your foot up on that block, bringing that back leg back a little bit further, rotating the leg out, bending at the waist, and extending to produce that stretch in the back of the leg. So following the popliteus stretch, we are then going to be stretching the quads. So again, placing your hands or one hand on the chair, we are then going to be grasping the ankle on the other side, pulling the leg up, and holding that for 30 seconds. So you should feel a good stretch in the front of the leg here. Then we're switching to the opposite side, holding for 30 seconds, and we're going to be performing this 3 times on each side. 28, 29, 30. And if you are not comfortable performing that in a standing position, we can also perform that same stretch on the floor with the use, basically an assistance band or with a long towel rolled up. First you're going to be lying on the floor, and we're going to be putting this over the leg and drawing up just like so. So we'll produce that same stretch in the front of the quads. We'll hold that for 30 seconds, 28, 29, 30, and then we'll perform that 3 times, and we'll switch to the opposite side. So again, if you don't have an assistive device like this, you can also use a long towel to perform the same thing. So just place that around the leg, holding there, hold for 30 seconds, and only go to the point of pain. You don't want to try to push past the pain with this. Over time, you'll get more flexibility and be able to pull up further. So you'll hold that for 30 seconds, relax, and perform that an additional 2 times so that you can perform that for 3 times on each side. 28, 29, and 30, and relax. So after we perform those 2 stretches, then we're going to be performing a few exercises to strengthen the knee. So this is an exercise called the quad set. So what we're going to be doing is placing a rolled up towel under the knee, keeping the foot flexed, dorsiflexed. We're then going to be pushing down into the towel and contracting the quads. So you'll hold that for 5 seconds, relax, and we're going to be performing 10 repetitions. So pushing down, holding for 5 seconds each time, and after those 10 repetitions, you'll switch to the opposite side, pushing down, and really just making sure that you're contracting the quads as you push down. So hold for 5 seconds, relax, again push for 5 seconds, and you're going to be performing 10 repetitions on this side as well. So after we're done with the quad sets, then we're going to move into the same type of isometric contraction for the hamstring. So bringing this leg partially up, we're going to be pushing the heel straight down into the floor until we're contracting the hamstring. So pushing down, holding for 5 seconds, relaxing, again pushing down, hold for 5 seconds. You should feel the contraction in the hamstrings. Hold for 5 seconds, and we're going to be performing that for 10 repetitions on each side. Hold for 5 seconds. Relax. Again, contracting. And holding for 5 seconds. The last exercise here, again, we're going to be focusing on the quadriceps. So seated with both feet on the floor in front of you, we are then going to gently extend one leg out and back down. So keeping that off of the floor, we're going to perform 10 repetitions very slowly, each time making sure you're contracting the quad at the top. Coming back down, again keeping that off of the floor, contracting. And after you perform 3 sets of 10 on each side, over time, if that becomes too easy, then we'll switch to 5-second holds at the top. So you'll hold it for that 5 seconds, you'll relax, bring that down, and then you'll perform that for 10 repetitions. And again, we're going to perform 3 sets of those on each side. So starting out, very slowly, making sure to contract at the top, back down. And again, once that becomes too easy, then you can incorporate the 5-second holds at the top and performing 10 repetitions with that as well. So thanks for tuning in, guys. Again, these are just a few simple stretches and exercises to be performing in order to increase your range of motion and limit your pain over the long term. So with these, we want to be performing these for two sessions a day, ideally in the morning and the night, and over time increasing to those isometric holds, the ones where we're holding for 5 seconds with each of those. Again, thanks for tuning in, and we'll catch you next time.